Vitiligo is a skin condition. It causes white patches on your skin. This happens when cells that make color, called melanocytes, stop working. Anyone can get vitiligo. It affects people of all races and genders, but it's more noticeable on darker skin. Vitiligo is not contagious. You can't catch it from someone else. It's also not life-threatening, but it can be emotionally difficult to live with. Vitiligo often starts as small spots. These spots may slowly grow over time. They can appear anywhere on the body. We don't know exactly what causes vitiligo, but researchers think it might be an autoimmune disease. This means that the body's immune system, which normally protects us from infections, mistakenly attacks its own healthy cells. In the case of vitiligo, the immune system targets the cells responsible for producing melanin, the pigment that gives our skin its color. When these pigment-producing cells, called melanocytes, are destroyed, white patches appear on the skin. There are other factors that might play a role in the development of vitiligo. These include genetics, meaning it can run in families, as well as stress and environmental triggers like pollution or exposure to certain chemicals. Some people first notice vitiligo after experiencing a sunburn or a cut, which might act as a trigger for the condition. The main symptom of vitiligo is the appearance of white patches on the skin. These patches are usually painless and don't cause any physical discomfort. However, they can be more sensitive to the sun, so it's important to protect the skin with sunscreen or clothing. Vitiligo can also affect other parts of the body, such as the hair and eyes. It can cause patches of hair to turn white or grey prematurely. This change in hair color can occur on the scalp, eyebrows, eyelashes, and even facial hair. In rare cases, vitiligo can also affect the mucous membranes inside the mouth and nose, leading to white patches in these areas as well. A dermatologist can diagnose vitiligo, which is a condition that causes patches of skin to lose their pigment. This is a doctor who specializes in skin conditions, and they have the expertise to identify and manage various skin disorders. The doctor will examine your skin thoroughly, looking for the characteristic white patches. They may use a special lamp called a Wood's lamp, which emits ultraviolet light. This helps them see the patches more clearly, as the affected areas will appear differently under this light. Sometimes the doctor might take a small sample of your skin, known as a biopsy, to examine it more closely. This is called a biopsy, and it involves removing a tiny piece of skin for further analysis. They look at it under a microscope to confirm the diagnosis and rule out other conditions. There is no cure for vitiligo, but there are treatments that can help manage the condition and improve the appearance of the skin. Some treatments help to restore color to the skin, making the patches less noticeable. Others help to even out skin tone, creating a more uniform appearance. Treatment options include topical creams, which are medications that you apply to your skin to help restore pigment. Light therapy, also known as phototherapy, involves exposing your skin to ultraviolet light to stimulate pigment production. This treatment can be done in a doctor's office or at home with a special light unit. Surgical options, such as skin grafts or tattooing, are procedures to replace missing pigment and can be considered for more severe cases. Your doctor will help you choose the best treatment option for you based on the extent of your condition and your personal preferences. Living with vitiligo can be challenging. It often brings about a range of emotions and experiences that can be difficult to navigate. It can impact your self-esteem and body image, making you feel isolated or different from others. It's important to remember that you're not alone. Many people around the world share your journey and understand your struggles. There are support groups and online communities where you can connect with others who understand. These communities can offer comfort, advice, and friendship. Talking to a therapist or counselor can also be helpful. They can provide strategies to cope with the emotional aspects of vitiligo. Protecting your skin from the sun is crucial. Sunburn can worsen vitiligo, so it's important to take precautions. Use sunscreen with an SPF of 30 or higher. This helps to protect your skin from harmful UV rays. Wear protective clothing like long sleeves and hats to shield your skin from the sun. Early diagnosis and treatment are important. Consulting with a dermatologist can help you understand your condition better. They can help slow the progression of vitiligo and improve your chances of regaining some skin color. Treatment options vary, so it's essential to find what works best for you. Remember, vitiligo doesn't define you. Your worth is not determined by your skin. You are strong and beautiful, just the way you are. Embrace your uniqueness and live your life to the fullest.